There we go.
Hello, hello. We are the infant feeding team, and it is Thursday and it's 2:30, and we are questions and answer session for an hour on anything to do with infant feeding, feeding by breasts, by bottles with breast milk, formula, and weaning as well, or anything in between, and anything that you're worried about.
Yep.
This is always a very lively session when we have lots of wonderful questions and lots of lovely people saying hello. So do wave at us and let us know how you're getting on. That's great. Tell us where you're coming from, because there are some of you not from Oxfordshire. That'd be really interesting to know. In the past we've had people from all over. So this session is just about feeding. We won't be answering questions on labour or pregnancies, or unless it's infant feeding related, or scans or visiting, you know, all the things, because we don't know the answers to all of those things necessarily. And there is a session quite often on a Monday now, Ask the Matron, and those are the perfect questions to save up for that session. So look out for that in the OMVP feed on Facebook, so that you can see when those sessions are coming up, and then you can have the questions, or you can look on the website on the Oxford University Hospitals Trust page. It tells you all about visiting and things, and the most up-to-date changes, and they are changing again. They've recently changed, as you probably know, so you can have 2 partners in labour, and you can have 2 partners, the same ones, for visiting on the wards afterwards as well, by arrangement. So things are moving slowly.
I think one thing to remind you though is that you know, anyone coming to visit you needs to come with a natural flow that they've done that morning. I've just been on level 5, which is our main postnatal ward, and we hear it all the time, people coming to the door buzzing to come in and visit and being sent back downstairs again because they haven't done a lateral flow. So if you are, you know, if you're in the hospital or you're coming in shortly, you know, be ready, you know, get your partners ready to do a lateral flow just before they come in, because otherwise it will delay them half an hour coming to see you. So getting that lateral flow done first thing in the morning, you know, when they get up, rather than having to delay seeing you by half an hour because they've got to go back downstairs, do a lateral flow, come up and show a negative lateral flow. So, you know, it is expected. I know things are changing elsewhere, but we are expecting anybody visiting the hospital to be doing a lateral flow on a daily basis and having it with them to show.
And you know, be respectful of that, because there are vulnerable people here, and we are looking after many, many vulnerable people, including babies. And as you will know, the levels are really high in Oxford again. They're really on the up, and you know, the staff are all getting the same. So we have got many staff absences.
Yeah.
It's all, you know, it's a knock-on effect on everybody. So the wards are really busy, and the staff are really spread very, very thinly at the moment. So you may have noticed that on the ward, that you're not seeing people very much because there aren't many of them. It's safe, but we are, you know, just sort of surviving really at the moment, and giving the best care that we possibly can, as always. But you know, understanding the situation, that it's not just in the community, that it affects everybody that works, and it has had a knock-on effect in the whole of the hospital, not even in just maternity. I think we had quite a major alert last week with staffing generally in the whole of the trust. So you know, things are quite hard at the moment, and so you know, we just be patient, and we'll, you know, the staff will give you absolutely what they can.
But it's also brilliant that, you know, we can see, I can see all the people coming up on the screen, because we can see your icons coming up, which is great. But you know, the fact that you're accessing these lives, whether it be our lives or the Ask the Matron lives, you know, that's brilliant, because it's giving you the information so that you come in, if you haven't had your baby yet, you come in better equipped to know what to expect and know what is normal. Because a lot of what we deal with is, you know, we meet parents and they're very concerned. I've been with a mother this morning who said on the second night her baby was beside themselves, and she ended up giving some formula, and we had a chat about it, because actually that's really normal behaviour for a baby on the second night. And
we have talked about that quite a lot in these sessions, if you're a regular customer.
But maybe, you know, maybe on that night that there wasn't the people who gave her that bottle of formula didn't realise it was the first time to give formula, and didn't give her the support to carry on and to know that this was normal. So it's using these sessions that that will equip you and empower you to know what is normal, and to be able to cope with with those early days, which are challenging, and it is difficult when you're on the ward and someone doesn't come straight away to answer your buzzer, but they will come, they will look after you as best they can. So I can see
difficult times. Have you got some questions?
Well, no, I can just see. I can see my computer's taking a while to load, so we have to bear with me. But I can see Charlotte's put a message up. I can't read it from here because it's come up on the screen.
Moment,
so Charlotte, I'll read your message in a minute, and any think about the questions you'd like to ask. All of you, anything that you've thought of. Don't worry if you might think it seems like a silly question, but the fact that you're thinking it, the likelihood is somebody else is too. So do put your questions up.
Don't we?
And invariably your questions will lead off to other things, and that may answer other people's questions. So, and we often find there's a bit of a theme. And in fact, we made a decision this morning because I said I've been working on the wards all morning, and I went to see one mummy and she was really bruised, so we thought we'd talk about hand expressing.
Yeah. So she thought she was misunderstanding, or her understanding was that she hand expressed from far behind, so it was 1, 2, 3, and actually we say 2 to 3 centimetres behind the base of the nipple, which is only about that far. So you seem a long way away today. So you're literally about that far. You shouldn't be up here trying to hand express up here. This is where your baby's mouth is. This is where your fingers need to be. And it's really important that you get that right, because it's the difference between you managing your baby's time when it's transitioning from just being born and adapting to being outside of the womb, to then suddenly waking up and thinking, actually it's time for me to make milk and have milk. And they go from 0 to 60 very quickly in that transition. And that's where your second night quite often comes in, where they just want to feed all night to chase the milk for the next day. So on the third night then the milk should start to appear, and your breast should start to have changes in them. So you need to be able to get milk out to reassure yourself, or colostrum, so you can reassure yourself that there's something there, but also that you're actually stimulating the receptors in your breast, which is the most important thing in the first few days. It's not about getting large volumes of colostrum out. It's it is tiny volumes of colostrum, and we also talk about this an awful lot. I'm rummaging about down here, but these are the syringes that we get you to collect from, and they've got 0.1. This is a 1 ml syringe, so it's got 0.1, 0.2, 0.3 mils, which is tiny volumes, and we'd expect you to get glistens when you first start doing that. And we don't know when your baby's feeding normally at the breast if you're just putting your baby to the breast and it's suckling, what your baby's getting. It's not about the food, it's about stimulating the prolactin receptors. It's about stimulating all the ducts that are in your breast that start making milk. And if you don't prime those, it doesn't work in the same way. So it's about that stimulation. And if your baby is very sleepy, which a lot of babies are post-delivery, particularly if you've had an epidural or you've had opiate methods, so diamorphine in labour, one of the injections that you have, your baby will get some of that, and it will make an impact on your baby's ability, depending on how much you've had and how long your labour was, their ability to play out their normal behaviours immediately. And sometimes they don't wake up and do the rooting that you'd expect in the early hours following the birth, and eventually over sort of 24 hours they come to a little bit and they start to play out more behaviours. So if your baby can't do that and they're not attaching, which causes a huge amount of concern to a lot of parents that their baby's not breastfeeding, obviously, you've got to find a way to get the milk or the colostrum from your breast, or to stimulate your breast to start the production of colostrum and milk. And so colostrum sits in your breast when you're pregnant, but it also is, it sort of changes over the next sort of 24 hours when the hormones that are in the when the placenta is removed start to tell the body to start to make milk, and it gradually builds up and makes more. So it's over 2 or 3 days. So it's really important that you have the skill that you can do that, and you understand where your fingers need to be in order to stimulate those receptors and get little bits of colostrum out. And that's really, really important. Alex is looking at flip charts that we have as teaching aids as well to give to mums.
I was just thinking for the hand expressing one to go alongside what you're talking about.
Absolutely. And so we make a C, and we do this so often with you, but it's so crucial. So many mums do that. And I was with a mum last week, and her poor partner was going, just do that, will you? Because she just, you know, because when you've had a baby, you can't take any instructions. So don't feel that you're being stupid when you're being told to do something and you can't quite get it, because actually you can't take on board any directions and any suggestions when you're a postnatal mum in the early days. You just don't understand what we're saying, literally. You just can't follow what we're doing. And she just said, I can't see what you're doing. And I was saying, make a C, and he was saying, just make a C with your fingers. But it's so important that you do that. And that's why we talk about antenatal hand expressing. So you learn before you get into your postnatal brain, where you can absolutely absorb a new skill. And it's so hard when you've got a newborn baby to learn something new.
Yeah.
You make that C, you go 2 to 3 centimetres behind the base of your nipple, you push back slightly with your C, still on that C, and you put your finger and your thumb together as imagining while you're compressing your breast. So you shouldn't be rubbing, so there shouldn't be any of that and rub. You shouldn't be rubbing like this. It's a very direct pincer action almost, and that goes right into those receptors, and then you start to get your little sweet spots in your breasts that have got little pockets of colostrum in them. And so you just keep going, push back, hold and squeeze for 4 seconds, and then repeat. Push back, hold and squeeze for 4 seconds, and repeat. Push back, hold and repeat. And it then starts to get the flow going. And then when it slows or you're not seeing very much, then you move your fingers, but it's a slow process. It's not quick, 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 quick. You know, it's slow, wait, move round, slow, wait. And then you start to see little glistens coming. You don't see, some people will have it pouring out, but not that many. It's more unusual to have lots of colostrum than it is to not have very much. So, you know, work with it slowly, be patient, and be very precise in your action, that it's actually really tapping in and you're putting your fingers together, imaginary, when it's on the breast, because your breast is quite firm. You'll find that it doesn't go very far, but it will go far enough if you hold and squeeze to actually start to move colostrum forwards and out of your nipple. So have a go with that. You can do some stimulation, you can sniff your baby, because that's always really good for oxytocin and lets things happen. Make sure you're not observed or you're feeling very uncomfortable or that you're feeling very vulnerable. Make sure you're comfortable in the place that you're doing it, because oxytocin is very, very shy and it doesn't give you anything if you're shy. So if you're really feeling stressed by anything, your baby's crying, it's not probably the best time to do that.
Yeah.
You do go to skin, calm your baby down, do some skin to skin. That will prime the hormones even more. Your baby will calm down, and then you can go back and do some more. And then do both sides. So go to that side, then go back to this side, then go back to that side again. And the second time you go, you probably start to see more flow. You'll probably start to see more coming. And as the day goes on, the days go on, you will start to see the colostrum volumes going up slightly. And then suddenly it becomes transitional. And then once you've got that stage, you can pump if your baby's still not feeding. You can go on to using a breast pump, because it's probably that you're getting more out than you can collect in a syringe easily, and it's a bit more messy because it's much more runny. So colostrum is thick like honey or syrup, and it's very, very high in calories, like golden syrup. Teaspoon of golden syrup, you know, for a little tiny bit in that syringe, it's equal to it. It's very, very high in calories and you know, wonderful things. So don't underestimate the small volumes you're getting, because it will make a huge difference to your baby. But more so than that, it will tap into your ducts in your breast, and it will start to tell your breast to start making milk. And the nearer you are to the birth time that you start that, the more milk you'll make. So if you leave it for 3 days and say I'll start later, you're 3 days behind in your milk production, and then you'll be surprised that there's no milk when you want it. Actually, you have to do it the day your baby's born, the hour your baby's born, either feed or hand express, in order to do that.
So in our teaching packs, we do a pack that we talk to mums when we meet them, and I know you won't be able to read it, so it's going to be back to front, but this is, has a lovely picture of a mum who we were allowed to video. And if you go onto our videos online, go OUH maternity feeding, and you'll see the maternity package of feed. There's a series of 7 videos that you can link into, and I don't know if you can see this lovely positioning attachment with this mother. She's hand expressing, so you can see 2 to 3 centimetres back from the base of the nipple. She's got her baby next to her, so that's really good from the point of view of oxytocin, so she's getting that oxytocin release. She's holding the syringe herself. She's doing a really great job, so she's managing to push the syringe back to collect it as she does it. And you can see a tiny little drop on the end of her nipple, just a tiny little white drop there, so ready to go. But so this is what we use when we're talking to mums on the ward, and exactly what Naomi's just said, that it's a food in concentrate, so it's very small volumes. Getting oxytocin going with massage is really helpful. Making that C and thinking about making sure that finger and thumb pad are going to meet, not too much like this. Finding the right spot, getting a rhythm, and expressing both sides at least twice.
And doing it frequently, so at least 8 times in 24 hours, and that's from if your baby's not feeding or you're separated from your baby for any reason, you do that from the day your baby's born. And there's no sort of give up on that one, because if you had your baby with you feeding, it would be doing the same. We say few feeds in the first day because it's not about food, but the stimulations are really important.
Yeah.
So if your baby's having 3 feeds at the breast, you can still do 5 more stimulations in that day, on the day that you gave birth, within that 24-hour period, to really, really tap into those prolactin receptors. We've got quite a lot of mums come back, and it's with babies that have lost weight, and it's always equating to how busy we are as well, because often you don't get the input as thoroughly sometimes if we're really, really pushing ourselves a lot. And so we do tend to, it equates to how busy we are as to how many more mums come back, because you don't often get the reminders to do the hand expressing as regularly, or you want to get home because it's so busy, so you don't get the support that you want. And so it goes hand in hand. But we know if you have an instrumental delivery or you have a cesarean, that the chances of your milk production being delayed is greater, and that we see the majority of mums that come back in have had a more interventional birth than somebody who's had a normal delivery. And it's usually linked to just not doing that early stimulation in the first day, and getting your baby skin to skin in that first hour. So we say just do it as soon as you can after you've had your baby. So the closer you are to the birth, the easier it is to make milk if you start that production going. So lots of stimulations, and you can't do it too many times. Make sure it doesn't hurt you, and we don't want to see you covered in bruises from doing it.
No.
I think we need to look at your technique if you're finding that it's really sore or you're getting bruises, because you shouldn't experience that. And you should be doing it yourself.
Yes.
You should be doing it yourself. You should have that skill, and you should be doing it yourself. We don't expect the staff to be doing that for you. And it is important that you have that skill, because it's your emergency care when you go home as well. So you need to be able to do it yourself when you go home if your baby's not attaching as well as you'd like it to, as you're just learning to dance together, because that's what it is. You're learning to dance. It's your new dance partner. And so you've got to learn together. And so you've got to go home being able to do that properly in order to maximise your colostrum collection, and start that production of milk, so that when your baby really needs that milk, after sort of 36 hours or so, 72 hours, you need that milk. You've got to make sure that you've got milk. Otherwise your baby doesn't get enough food, and then that's what happens, is you come back in because your baby hasn't got quite enough. And we talk a lot about how do you know if your baby's got enough milk. We've got lots of questions.
We've got
that you'd like to
yeah, let's go do some of our questions before
Yeah,
we
then
go
we'll
on
come
to
back
that.
to
And then that
knowing
might
how
come
much
up
your baby
anyway.
gets,
So
yeah.
I'm going to start with Charlotte, because she's always one of the keen bees and on there
You're a
first.
star
So
fan.
I know she is. She says, "Hi ladies, I'm back again. I try not to keep asking questions, let others ask you." Her and Alicia are from Oxfordshire and know you ladies well. We haven't missed many chats. No, you haven't. You have definitely.
#1 fan.
Definitely frequent
We
flyer
love
points. Yeah,
Love
very
it.
much so. Emily has said, "I'm planning to go to the spas when I go into labour. Who do I call now?" I think you never go wrong phoning MAU. I mean, this isn't our remit, as we said, this is because we're infant feeding, but I think you'll never go wrong phoning maternity assessment unit. So
Your midwife should give you that number.
yeah, so I'm not sure at the moment whether you're phoning, whether mother's phoning SPA's direct at the moment, but maternity assessment unit would tell you. So if in doubt, phone maternity assessment unit and they will signpost you, would be my answer
And
on
check
that
with
one.
your midwife if you're seeing her soon, and you're not quite
So
due.
see what the latest is on that.
Yeah.
Harriet has said, hi there, I had my baby at the JR a couple of weeks ago. I had harvested a few mils of colostrum antenatally, which I brought, but unfortunately got lost between freezers during ward moves. Will my baby have missed out on that first bit of colostrum, or will my body have made more for him after birth? You've brought up some really important points there.
Yeah.
We talk about this a lot.
Yeah.
We really highly recommend you do not hand over your colostrum
To
when you
anybody.
come in. We really recommend, because you are not the first, Harriet, and you will not be the last, because of the sheer nature of the building, where we have 400 midwives and a couple of hundred maternity support workers. Unfortunately, this happens. So we would highly recommend that you bring in only the barest minimum, and that you keep it with you in a cool box on ice blocks, and if you need more than you've got, that someone goes and gets it for you. Has your baby missed out? No. As long as you had it, to be honest, it's there as a backup, it's there as an insurance policy. If you had the milk to feed your baby, it doesn't matter. It was great that you got that skill before you had your baby. That's the important
One thing you got was that you could get milk from your and colostrum from your breast. You learned from that, and that's the whole point of it. And it doesn't mean that you make more milk if you harvest colostrum before you have your baby, because you've still got your placenta in. But what you do have is a really good skill that means that you can get milk out or colostrum out really effectively once you've had your baby, because you've got the skill there.
So your baby will not have been disadvantaged from not having that colostrum at all. And very often we find when mothers have expressed colostrum prior to the birth, and then the feeding goes brilliantly, they don't ever even give that colostrum. It doesn't matter. It really doesn't matter. It's there should you need it. Should your baby sadly have to go to the neonatal unit, it's there, if your baby's having to have their blood sugars checked and the blood sugars dropped and you can't get anything off right there and then. It's for that sort of thing, really. If your baby's born and they're a bit lighter than we would like, then we're going to give them as much food. But if you've coped, Harriet, then your babies are not missed out at all. Do not worry. But it makes a really good point about please do not bring much in and do not hand it over, because you are not the first and you will not be the last.
And the other thing that happened to me a few weeks ago is that a mum came in. She came in because her baby had lost weight, and so she'd expressed some milk. She'd expressed quite a large volume of milk, and she hadn't realised she'd put her expressed colostrum, antenatal expressed colostrum, into that milk, and her baby took about 10 mils, and it was more than an hour by the time she got in, and she couldn't give any more of it because it had been open for, the bottle had been used for more than an hour, and she put her colostrum into it, and she'd got a huge amount of expressed milk. So if you're giving your baby little top-ups, or you're giving your baby the colostrum, use tiny amounts and add to it, because once you've got your baby's saliva on the teat and it goes into the milk that they're feeding on the bottle from, for breast milk and formula, you can't use it after an hour because of best practice and bacterial growth and things like that. So don't bring large volumes, don't put large volumes of milk into a bottle and then keep using it, because that's not best practice. Just use what you need and add to it if you need more, and then that's okay for an hour, and then you can't use it after that. So if you fill a bottle up and offer 10 mils and it's got 100 in it, and your baby won't take any more, you can't use the rest of that bottle.
Much better off decanting, having a bottle with the majority, decant into a smaller one.
Especially in the early days, but she lost her colostrum that she'd expressed because she'd put it in with the milk, which is a brilliant idea. If she's got loads, she had loads and loads and loads of colostrum, and she brought lots and lots of it in. But once it's defrosted, you've got to be careful with colostrum how long you can use it for, and also if you put it with your expressed milk, to give extra things to your baby from the colostrum, because your baby's a little bit older. It was 3 days old. She couldn't use it anymore, and she just had no idea that she couldn't keep using that bottle. So make sure that best practice is you just decant and use a bit, decant and use a bit, and then you don't throw unnecessary volumes of milk out, which has taken a lot of effort to put in a bottle, and we know how much effort it takes to express and give your baby food, so it's so precious.
Right, I can see how it's come back already. Thank you. That's brilliant. But yeah, your baby's not been disadvantaged at all. Unfortunately, it's just
But a great question. Such a good point.
But it brings up so many things that are so relevant. So it is an ongoing problem. And, you know, we'll go to fridges and freezers and find milk for women who have not been in for a while.
And people see them and they think, well, she's not here. We don't know where she is, and it's no longer.
Yeah, hang on to your own milk. Don't let anyone else get it. Charlotte's put another thing up. She just said she's looking into the Access course for becoming a nurse or a midwife. So, yeah, she messaged me the other day about that. So fabulous. Good luck.
Lovely journey.
Helen has said, I'm currently 37 weeks and leaking quite a lot. Is this normal? I've started hand expressing to collect in syringes so it doesn't waste and filling the syringes up fast, often waking up with patches. I've had some leaking since about 16 weeks. Now
Absolutely
I know
normal.
This links into another one. So Elise has said, hi there, when should we start leaking? I'm 25 weeks and had nothing yet. So two questions. Normal. You're both normal. You're both completely normal. So
some people really leak and some people don't leak at all.
No.
And it doesn't mean there's something wrong.
No. And it has no impact on your supply after the baby's born. So it doesn't mean that Helen will produce more milk, you know, than Elise. So it's going to be no difference in that respect. So, you know, you both have the propensity to produce enough milk for your baby, regardless of whether you leak or you don't leak in the antenatal phase. And some women will find when they've had their babies they have to use breast pads all the way through when they're feeding, and other women don't use breast pads ever. And I've known women who've used them for one pregnancy, well, one lactation and not another. So it's no bearing at all on what's going to happen in the future. And Helen, you know, you're saying you're getting lots and lots. That's fantastic. You know, unless there's a risk factor for your baby, you don't need to get too much. You know, the sort of babies we're worried about, we've already touched on it, are, you know, babies that might be small for gestational age, or babies that are a little bit small in their tummy, so what we call IUGR, so intra-uterine growth retardation, which means they're just growing a bit slower. Babies of diabetic mummies, so mummies who've got diabetes, we would highly recommend they come in with some colostrum. A baby that we know might be going to the neonatal unit for any reason. So those are the mums that we'd be highly recommending that they are expressing before they come in. Other than that, it's a bonus. It's, you know, it's just something that's great. So don't worry, Helen, about collecting too much.
It's about learning the skill, as we said earlier. You know, it's about learning to use your fingers in the right place.
Yeah.
Because then you know where your sweet spots are when you have your baby, and that is really helpful for when you want to give food to your baby if they're not feeding.
Yeah.
Because many babies don't breastfeed in the first few days. They just don't, you know, they don't wake up, they don't open their mouths as much, they've got tummies full of yuck from the birth. You know, they need to pass a bit of meconium to clear their tummy out, everything starts to pass through, and they don't feel hungry. So the good thing is that the colostrum that you give is a laxative, so it just helps push everything out. And when you push all that meconium out, it reduces the risk of jaundice as well, because the longer meconium sits in your baby's guts, the more the increased risk of jaundice for your baby. So you want to move it. So the more you feed your baby with your colostrum and your breast milk, the more it removes things from the gut that would start that risk of jaundice off, but also that it actually makes your baby have hunger cues as well. It starts to feel hungry as its tummy starts to be ready to receive food. So you know, it's not just about one thing. It's lots of things all together, and that's really important that you know that.
Right. Right. I'm going to go back to Leanne, because Leanne's message came in between the two, between Helen and Elise. So Leanne has said, hello lovely ladies, when I go back to work, how do I know how much breast milk to get out of the freezer? Is it a trial and error situation? Pretty much, yeah. I mean, we anticipate that a grown baby's stomach size is somewhere between 80 and 150, so you could use that as your ballpark. But, you know, we don't know what Lyra will have at this stage. So it's going to be a case of trial and error, as you say. You know, once defrosted, it does need to be used within 12 hours. So that is, you know, that we don't want you to be wasting milk, but that is what you need to be looking at. So, and you know, you get feedback from whoever's looking after her when you're at work. You know how much she's taking, and that'll be your guide going forward.
You know, you can always add it to her porridge or something. If you've got to the end of the day and she hasn't wanted it, you can always add it to mashed potato or you know, her breakfast or something,
Yeah.
mashed banana, and that she can have it with that as well. So you don't ever waste it.
No, actually, there was I don't know if it must have been frozen if it matters, but I can remember when I was younger there was a ice cream recipe going around for breast milk ice cream. Do you remember?
I think it was sold sometime, somewhere in Covent Garden sold it, wasn't it? And
Human
everyone was
milk
horrified.
ice
Cream
cream.
and milk ice cream.
Why not? I bet it's really sugary. I bet you don't
It's
have
really
to.
sweet.
But you don't have to add any sugar to it.
Most
So,
people don't taste it, but it is very sweet.
how silly. Anyway, so Leanne, all the best. I know that's looming
I know,
now.
it's very
Who
scary,
could
isn't
believe
it?
it
But
that
you will
you're
be
already
fine.
at that stage? Amazing.
You will be fine.
Right, so Harriet come back and said thank you. Tanique, oh, you've been on before as well. I remember talking to you before. She's exclusively breastfeeding her 7-month-old now. Well done, you. Her periods returned 8 weeks postpartum and was on time each month. Last month, my milk supply dropped for about 2 weeks. I pumped and fed baby all day long till it came back, which it did. I put it down to me being due on. This month my milk has dropped again from producing 700 mils to 100 mils, but this time my period is currently 3 days late. Could it be pregnancy or just hormones? Could be.
Well,
Yeah,
that's how long is a piece of string with that one.
I mean, it could
You know, if you're on contraception, you should be covered ideally. But if that's not the case, and the other thing is that you might have been ovulating, having periods, but not quite in the same way, and now you've reduced your exclusivity because your baby's 7 months old. You are offering other foods, hopefully at this point. I'm assuming that you've introduced some sort of foods, and that might have just dropped your the amount of breastfeeding that's going on a little bit, and that might be just enough to increase the hormone input, and you might find that your ovulations change slightly, and it could just be that the whole breastfeeding and ovulation and moving on to the next phase has just changed it slightly. Some people do experience drop in milk production when they ovulate. It's not normally for a couple of weeks. Have you just changed to different contraception, and it might be that you're on a different type of contraception, and that sometimes happens as well. You could be pregnant, of course you can. You've been having periods since 8 weeks, so you know, you get pregnant before you have a period. So many people come back 10 months later because of that. They don't realise. So it could happen. People do get pregnant when they're breastfeeding. It does happen, and particularly if you reduce the amount of breastfeeds you're having because you've introduced other foods. And we know that the you know, the safe method of breastfeeding for contraception is up to 6 months, where nothing else is added. So no dummies, no teats, no more than 6 hours between feeds, no other foods, and that gives you very good, reliable contraception if you follow those rules. And it's used in many countries in the world as a form of contraception safely. But if you drop those things, your baby sleeps for longer, or you're introducing other foods, then the risk of getting pregnant is much higher, even if you're still breastfeeding. So if you've changed something, if your medication's changed, your contraception's changed, it could be that your breastfeeding pattern has changed because of introducing solids, your baby's sleeping longer. It could be something like that that's made your production go down. But if you can get it back up, that's brilliant. I know it's hard, and babies often feed more frequently to increase the supply naturally as well.
So all the best, Tanique. And I think you've got to say, you know, well done you. You have exclusively breastfed your baby for 7 months. That's amazing. There are so many babies in the UK that do not get that first 6 months of exclusive breastfeeding. So
real feat.
You know, I think you've got to just really pat yourself on the back for that. That's a fantastic achievement, and you've given your baby a brilliant start in life. You know, hopefully, keep going. Any milk is beneficial, and obviously at this point in time, it's usually alongside other foods as well. So all the best. Antonella has said she's 40 weeks on Saturday, and she tried to use the pump, but she didn't. She only got a little bit of colostrum. Is it possible? Is it normal to have no milk or have very little colostrum? When does the milk start to come out, before or after birth? So at this point in time, Antonella, we would not recommend using a pump, because colostrum, as we mentioned, is thick and gloopy. It is like golden syrup, which is why we hand express and collect it in the syringe that Naomi was holding up earlier. So this is a tiny 1 ml syringe, and it's perfect because it collects the droplets that you get. Because if we get our stomach sizes out,
we haven't had
them out this week.
Gosh, I'm slacking.
Because your baby's tummy when they're first born is absolutely tiny. It's the size of a cherry. I'm going to get out. And they do not want big amounts of food. So it's this big. It's absolutely tiny. So your baby does not want big amounts of food. They only want
amounts in one of these.
So at this point in time, we're not expecting you to be able to use a pump. We don't recommend using a pump until after your baby is born and your milk starts to come in. So at the moment you have colostrum until your baby is born, and once your baby is born and you have delivered your placenta as well, then the milk production starts to ramp up. So you have
hormone levels change, don't they?
Because there's progesterone in the placenta that's blocking prolactin. So what happens is once your placenta is delivered, the milk supply will start to go up. It does not go up until you deliver your placenta.
And it doesn't affect your milk supply if you take that milk out before you have your baby either. The whole point of it really is to learn a skill by hand express. So when you have your baby in the early days, you've got the hand expressing skill, and that's what the antenatal hand expressing is about, is you learning that skill, not getting milk for your baby necessarily. That's the bonus that you get from it, but actually it's learning the skill so that when you've had your baby, you've got the skill and you can do it really easily, and you know exactly where to work on your breasts to get the milk, the colostrum out in the early days, and if you need to hand express to get milk out. But actually it's the early days when your baby may not be feeding that you need that hand expressing skill. So if you're pumping, you're not learning how to hand express, and that's what we'd like you to do, is just to recognise that skill and you know, make yourself aware of your own breasts, because actually not many women do that when they're not pregnant. You know, they don't know where milk production is and things in their breasts, so it's a new thing to most women if they haven't breastfed before. So it's a new thing that you've got to learn. It's very, very strange doing it, especially when you haven't got a baby. You know?
So watch the beginning of the video of this again, if you can watch it again, and then afterwards Naomi went through hand expressing. The other place to look is we did a video about it and we filmed a mum. So if you have a look on, you could do a Google search and you can go OUH, so as in the hospital, maternity, feeding, and then you'll see the maternity playlist, and it's 7 videos, and one of them is specifically about hand expressing, and we film a mother hand expressing, and you'll see what she's doing. So I would suggest, Antonella, that you have a look at that, and don't forget the pump. Leave the pump until after your baby is born. So just because you're not getting milk now does not mean anything. In fact, you said you got a little bit, so that's probably all we would expect. So milk comes after the baby is born. Colostrum in small amounts is now, and many mums don't get any in the beginning. So have a look at the video, Antonella, and maybe have a go with your hand. But don't worry, you will have milk.
Yeah. We assume everybody makes it until they don't, and nearly everybody does make it.
I'm giggling because the next comment is from Elise, who's the one who's saying that she's not leaking, and she's gone, phew, thanks.
You're starting to feel normal, ladies.
So there's such a gambit of what is normal, such a big variance of what is normal, and that's what we're saying at the beginning of this session. You know, we may not have the capacity to spend lots of time with you when you have your babies, but if you can access these and ask the matrons and just read up, access our videos.
Tell all your friends to watch it.
Yeah, it will give you such an idea of what is normal, and therefore give you a better experience going forward. Like the mother I mentioned, you know, who on the second night was completely taken aback because her baby just didn't stop crying. And I said, but that's normal baby behaviour. That's normal.
Chasing the milk.
So, you know, put your baby skin to skin, you know, keep trying them at the breast, hand express, get through to the morning. Don't make a decision about giving them anything else at that stage, because that's not the right time to make a big decision. Harriet has said, I should say he's healthy and gaining weight well. I was also wondering, when is it okay to introduce a bottle of express breast milk for him so that Dad can occasionally do a feed? I don't want him to get nipple confusion and compromise breastfeeding, which is going well. Now I'm trying.
7 months old. Is that what
Harriet's baby was younger than that, I'm sure. I'm going back. Harriet, 2 weeks ago. So if you've got breastfeeding well established, then he will cope with both. We tend to find most babies do cope with both, don't they?
I think it's not usually nipple confusion, it's nearly always flow confusion.
Yeah.
So if you've got low supply and you start introducing bottles, your baby will get cross at the breast because the flow of the breast milk is not the same as in the bottle. So when the baby has a bottle, it's a constant flow, and as they suck, they get a hit, and they suck, and they learn very quickly that that flow is constant. And so when a baby breastfeeds, the flow of milk, it changes, it's fluctuating. So it's fast at the beginning if you've got the normal amount of milk, and then it slows down towards the end of the feed. So babies that get lots of bottles and you're breastfeeding and you've got low supply, they get very frustrated at the breast because of the flow. So it's about protecting your milk supply. So if you do give a bottle, don't replace it, you know, if it's not going to be a permanent sort of one at 10 o'clock at night, say, which is what lots of mums do. Make sure that you stimulate your breast when that bottle is being given, so that you keep that flow there and you keep that supply. Because once you start introducing bottles into an equation frequently and you don't breastfeed, then your supply dumps down very quickly, and it's very surprising how quickly your production goes down if you don't ask them to make it, because it does what it says on the tin. If you don't ask, it doesn't do it.
Yeah.
So you know, you really have got to be aware that the flow is there. The rate at which the milk goes into the baby's mouth is very addictive for babies. That's what they really love, and they just let you know if that flow's changed in any way. They will start fussing at the breast, they'll start pulling, and they'll be wriggling, and their hands will be going, and they may well even cry because they are expecting that hit throughout the whole feed. So one of the things you can do if it does happen and you're listening and you're saying, well, that's what my baby's doing, is you can do some compressions when the baby starts to fuss. So you can squeeze as far back to your chest wall as you can go, so that you're going deep within the breast, and when your baby suckles, you squeeze, and when they stop suckling, you let go. And then when they start suckling, you squeeze again. And it's not pumping, it's not that, it's holding and squeezing, and you're pushing milk into your baby's mouth like they get a flow, a constant flow, and it increases that flow. If your baby's falling asleep really frequently, then you can do what we call switch feeding. So as soon as they stop feeding and they get, you know, cross, you take them off and put them on the other breast, and you do compressions on that side, and you give them their hit, and then you go back to that side, and then you go back to that side and back to that side, and you know, you do it as much as you can. So in the early days when babies are sleepy and your supply isn't quite up, this is a really good way of stimulating your breast to make more milk, but also give your baby flow. But if your baby's a little bit older and the supply is, you know, you've been using bottles and they're getting cross and it's flow, then you can just use compression, and it's a really good tool to use without anything else.
You can really see it as well when you do it. When you do compressions well with a mother, you can watch that baby's jaw drop. So what you're watching when the baby's feeding is that they're going. And what you'll often see is when you do the compressions, that jaw drops even further, and you can really see they're taking that bigger mouthful.
Their eyes often open again.
Yeah, it's like,
they may have got their eyes closed,
food.
and suddenly they go like that because they've got flow again.
So
they're very flow driven. You know, it's not usually nipple confusion. It's nearly always flow with babies. They just want that hit, and it's important that they get that by you protecting your milk supply. And you know, by introducing bottles, you've got to protect it if you want to keep breastfeeding.
a really good way of working out where compressions are working best for you, where you get the best sort of response to it, is doing it while you're pumping. So if you can manage to do a compression while you're pumping, you can work your way around the breast, and you work one area for a while, a bit like hand expressing. You don't keep moving. So you get your hand on the breast, nice big hand for the breast, in and hold, and then in and hold. And actually, whilst you work your way around the breast, you'll find out where your sweet spots are, where the best places are for you. And that's what you can transfer to feeding the baby at the breast, and really increase the volume of milk a baby's getting at the breast.
So if you're doing expressings and you want to do some compression, use a pair of scissors, you know, not a pair of scissors, but your fingers like a pair of scissors, and then you've got your thumb and your fingers around the rest of your breast, and you compress while you're holding on with your fingers, because it's quite hard. Or you can get a boob tube or an old bra or anything, you know, and just cut a little hole in it.
We use Tubi Grip here.
We do.
So,
I was double pumping, you know, you do it like that and hold and squeeze, and that's what we teach mums on the ward to do it.
Yeah.
But you can really get into those receptors when you're doing that with the funnels.
keeps babies awake, doesn't it?
It does. It really does. And you might give them an extra 10 mils if you're, topping up your baby. 10 mils is quite a normal top up in the early days. You can get that out by compressing quite often, and then your baby gets more food and starts gaining weight. And you see it on the scales, and after about 2 to 4 days you start to see your milk production going up when you're doing it as well, because the compression is stimulating your ducts to make more milk. So your baby suckles for longer, it's more effective, and you do see more food, and also your baby starts to gain weight more. So it's a really good tool to have with not very much skill needed in order to do it, which is really important. You don't need people coming to your house and telling you. If you know how to do it and you've seen these videos, just do it, because it does work.
Right, that was Harriet's question. Helen has come back. She was the one who was doing really well with the hand expressing. So she said, no risk factors, just going to express a couple of weeks to practice the expressing. Thank you. So exactly, learning that skill, this is the time to learn. It's always easy to learn a new skill now.
In your own home with your cognitive ability still present.
And Elise has come back as well. Also, sorry to ask another, not a problem at all, we don't mind. I have both nipples pierced and been keeping them super clean. I don't really want to take them out as a long term. Will this obstruct my milk flow in any way? Is it safe to keep them in when not feeding? I'll take them out and disinfect when feeding the baby. I can't see any problem with that. You might just leak. So
yeah, I mean, sometimes there's a bit of scar tissue and flow doesn't come out as quickly where the piercings are. Sometimes it comes out much quicker. It depends where it's pierced. So you just don't know till you do it. But I wouldn't advise breastfeeding with any piercing things in jewellery in your nipples, as you've said.
She said, yeah.
So just be wary of that, and just see what happens. Yeah. Just see what happens.
You won't be the first. No. Charlotte has come back. Charlotte, she's so good at keeping our messages going. Food before one is just for fun. So she's so right. So that links into Tanique talking about, she's got her baby's over seven months now. Leanne has come back. Thank you. I've bottles of between 80 and 100, so that should work well. And I'll use Naomi's tip of mixing any remaining with her meal. It would break my heart if it went to waste.
Totally.
This time next week we'll be celebrating her first birthday. And I mean, that's amazing, because it wasn't the easiest of starts, and look at you now that you're able to do that. It's so brilliant. Yeah. This time last year was a very different matter. Beth has asked a question, and it's a really good one. Oh, that's us. I'm sorry, I forgot my bleep was in my pocket. Can PCOS, that's polycystic ovary syndrome, affect milk supply? I forgot we had that. Can't see what that is, I'll have a look in a minute. She says, can polycystic ovary syndrome affect your milk supply? Yes, we think it can. Certainly when we're talking to mothers about risk factors with regard to milk supply, the things that we look at are polycystic ovaries, because we know that can have an impact. It's hormonal. Hypothyroidism, again hormonal. Diabetes, again hormonal. Any breast or chest surgery, and if mothers had to have fertility treatment, again hormonal. If you think about it, hormones drive milk production, so if there's anything that impacts on those hormones, it can have an impact on your milk production. So Beth, that is something that we would be considering. I don't know when if you've had your baby or you're expecting at the moment, but it would probably be worth giving us a call and having a quick chat about your situation. It's such a big spectrum, PCOS. So polycystic ovary syndrome can affect women in so many different ways. It can impact on their breast development, and so for others it doesn't at all. So, it's so variable depending on each woman. So it'd probably be really worth having a quick chat. Give us a call on our telephone number. You can find us via the website or an email. And I think it would probably be worth having a quick chat with you about it, just so that we can get you off to the best start possible. So we tend to talk to mothers, and anyone else that's listening, we do a lot of antenatal calls. We probably do 2 or 3 antenatal calls a week now, talking to mothers who have a risk factor for not producing enough milk or had problems previously. And so what we do in those calls is talk about if it's a second or subsequent pregnancy. We talk about what happened last time. And what we're always looking at is how can we make you get off to the best start possible? How can we give you the best chances of getting the most milk possible. So I would highly recommend, Beth, that you get in touch with us and we could have a quick chat about your situation and whether we should be concerned or not, and what we can do to give you the best chance possible to get
I mean,
off to a good
sometimes
start.
mums with PCOS, they make too much milk
Yeah.
as well, so it's not always under supply. Sometimes it's too much milk, and that's almost harder. It's quite a big thing. So, and if any of you are listening that have had lots of milk, it isn't an easy thing to work with. So, you know, that can also be an issue. So you don't know till you find out. And there is Oxford University has just started a trial of testing hormones on mums, haven't they? And they're recruiting for mums to give blood samples to see what hormone levels are like when they're you know, prolactin levels and things like that. So there are posters up in the lifts and things now. So if you're coming into the hospital and you see that and you're interested, then you know, go forward with that trial, because it is helping to answer some questions that we don't have about PCOS, about hormones, about prolactin levels, why some mothers make milk and why other mothers don't. You know, because it is something that we see on our daily practice, that you know, milk production is a huge impact on people's lives, and a source of great sadness for a lot of people, and we don't always have the answers for it. We often do, and we know that we can rectify it, but sometimes there's no answer, and so they're looking into that as a research project. So if you do see that, if you see the poster, it's in the lifts. I saw it this morning, it's just gone up. So do put your name forward if you're interested in being part of that and you want to know more.
Brilliant. On to our next one, which is Claire, another one of our regulars. So she says, "Hi both, just to update you on my quest to donate antenatal colostrum. Amanda Wood, who is our milk bank coordinator, confirmed that I'm fine to donate prior to 37 weeks because I'm already breastfeeding my 21-month-old during this pregnancy. I'm 32 weeks now, so I've already got 100 mils of colostrum so far in the freezer, ready for the milk bank, just in case this query comes up again. Thanks for encouraging me to explore this with Amanda." So well done, Claire. So you're doing an amazing job. Not only are you feeding your baby, or 21 month, growing another one, you're also going to donate and help other babies. So that's amazing.
And they love that colostrum in the neonatal unit for the newborns that come in, you know, in the early days before they get to receive mature milk, that can have oral feeds. You know, it's life-saving for them. It stops lots of different things happening to very, very premature babies, and it's really important for their development. So it protects their gut from infections and things.
And you know, 100 mils will go a really, really long way.
Babies, probably,
or go more. A really long way. So that's fantastic. So thank you so much, Claire. That's absolutely brilliant, and thank you for updating us. And maybe our paths will pass across when this one arrives. Although I don't think you need any help this time. I think you're going to do brilliantly. Yeah. Well, good. Just let us know you're on the ward and we'll come say hello. So if you're in, that is. Antonella has come back. I was worried, but now it's a little clearer. Thank you so much. I'll take a look at the videos. Well worth it, Antonella. And anyone else who's antenatal at the moment, you know, have a look at those videos. We're really aware that it's very patchy what's being done for antenatal classes. We've covered a huge amount in our 7 videos that are on there. We're not destined to be in front of a camera. Neither of us are going to win an Oscar or a BAFTA, but we do get the message across. So, you know, we cover skin to skin, responsiveness and relationship building, hand expressing, pumping. What else we do? How do you know your baby's getting enough milk? And using alternative feeding methods, so bottles and things. So bottles and cups and things like that. So it's well worth having a look. We do cover a lot. You know, try and skill yourselves up before you have your babies as much as you can. Shanique's come back. Yes, Theo is on solids and he loves it with a big smiley face. He sleeps through the night and has done so. Oh, don't tell everybody that. Has done since 4 weeks old. Unusual. Never. Very, very unusual. When my milk supply dropped last time, I changed our routine slightly so I could do night feeds, which I feel helped a lot. Yeah, they would do.
Absolutely.
I'm not using contraception due to side effects I experienced. Missing my period is throwing me off, as I have had normal periods since 8 weeks postpartum, but I wouldn't mind another bubs. Oh, that would be lovely.
Such a nice little story. Well done, you.
Elise has come back, very helpful and reassuring. Thank you so much. Charlotte has come back. Happy Mother's Day to all the mums listening to this chat and all new mums to be. That's a lovely
nice.
point. Yes, Charlotte. Happy Mother's Day to all of you that are celebrating it for the first time, and anyone who's celebrating.
Although it should be every day. Happy Mother's Day should be every day.
Yeah, absolutely.
Mothers are to be revered.
Beth has come back. Thank you. I'm currently 22 weeks. Got a little while until baby's due. When do you suggest I phone? Well, if you phone now, we'll book you in for about 34 to 36 is what we tend to do. So give us a shout and we'll get you booked in for an appointment nearer the due date. So,
or you can email if it's easier, and that's infantfeeding.team@ouh.nhs.uk. And you can just email us your details and we can phone you or email you and work out a convenient time. It's whatever you prefer.
Charlotte's come up saying this May her amazing Alicia Jasmine in fact will be 2 years old. There you go. Isn't that lovely?
True lockdown baby.
Yeah, absolutely.
2 years yesterday, wasn't it?
Yes, the 23rd. Yes, it was indeed.
So what's happened?
Yeah, I know. It's so funny, that date really rings a bell. I know my daughter made it back in on the day of lockdown from abroad, so.
And it's nearly 2 years since we started doing these sessions, which is even more important, isn't it?
Yeah, it was April we started.
Yeah. So, it's been a real journey for us as well, sitting here doing this and getting such amazing positive feedback from everybody, and we got a call earlier on this week saying, I love your live sessions, I love live sessions, I just want to talk to you. And so that's what it was about. She'd been listening to us, and that's great. So it is getting the message out. People still, say they've seen it when they're on the wards. As stuff is happening and people are getting busier, it's not quite as busy on the views, but do pass the information on. Tell people at work if you're working. Share it with family and friends, because it's not just for Oxfordshire. It's if you can get the questions and answers out to everybody, then it will support breastfeeding, and that is really good. It just spreads the word for it, and it's such a great interactive session that we can answer directly questions straight away, and you ask such brilliant questions too.
Right, well, it's 27 minutes past. If we've got any more questions, I think we're just about done then, aren't we?
I think so, yeah. And just keep thinking about those questions for us, because it is such a helpful tool for lots of other people that may not have thought about the questions you ask, but actually think, oh yeah, that's a really good question.
So I think we could probably just finish thinking about brain development. So, what's that to do with feeding? It's something that we talk about a lot here, and some of you obviously haven't been on our sessions before, but I've got a picture of a lovely colourful brain here. This is to remind you that every interaction that you have with your baby, whether it's before you've had your baby, so you're aware of them moving, they can hear your voice, that interaction with them is really important, because that helps you bond with your baby when they're born. Visualising your baby, visualising meeting your baby for the first time. And then when you do have your baby, keeping them close, that first, skin to skin when the baby is born, not letting your baby go away to be weighed or have obs done or have cuddle with somebody else, keeping your baby with you for at least the first hour until the first feed has taken place. And keep responding to your baby's needs, talking to them, making eye contact with them, cuddling them, keeping them close, whether it's you or your partner. And every time you do that, what you do is you feed their brain. So the baby's brain is really growing, and our breast milk is really important. It's full of sugar, and that's helping with the brain too. So we've got two amazing things going on. Oxytocin, which is the hormone that's released when the baby's kept close and their needs are met, is the brain fertilizer, and the glucose from your colostrum and from your milk is the sugar that grows the brain as well. So you've got two amazing things going on. So thinking about meeting your baby's needs, not just from nutrition, but from the interaction with your baby, grows a happy baby, which becomes a happy toddler, which becomes a happy child and happy adult, and protects them against mental health issues going forward. Yeah. They need to know they're loved. They need to know that they're cherished and you're going to meet their needs. You cannot spoil your baby, you cannot love your baby too much, your baby cannot manipulate you, and you cannot overfeed a breastfed baby. Anything to add to that?
No, I think it's a perfect food, and but also you can still do all of those things if you're giving baby bottles. You can have the oxytocin, you can have the skin to skin, you can have the closeness, the interaction with your baby. You can still grow your baby's brain with that as well. So it's touch, isn't it, and cuddles and loving your baby as well. and the more skin to skin you do, the better. And it's not just at birth, skin to skin goes on forever. And I always say when I talk about it is that people come back pregnant because they love skin to skin. It doesn't ever go away. So
We all like it.
everybody likes skin to skin. It's a feel good thing, and it does make you feel much happier. It releases oxytocin, and that does grow babies' brains. Yeah, it's really important for development. So on that note,
No, we have another question.
oh, lovely.
Taya has
Someone
snuck in.
snuck in, yeah.
Taya has snuck in. She said, I'd love to know more about breastfeeding, which I'd like to do exclusively, but also latching techniques and colostrum harvesting. I'm currently 30 plus 5 weeks. Where can I access these videos, please? So if you have a look, go online, do a quick Google search, do OUH, as in Oxford University Hospitals, so OUH, maternity feeding, and that will bring up our webpage, and then you look down and you'll see it says maternity playlist. The maternity playlist will take you to YouTube, and there are some videos there, and you'll recognise us because we're on them. So so it's OUH, maternity feeding, and then down to maternity playlist under resources, and then that will link you to Facebook and our videos.
And don't forget that these sessions, they're all recorded on YouTube as well. So if you go into OMVP, Oxfordshire Maternity Voices Partnership, Oxfordshire, breastfeeding, the videos will come up that we've done for 2 years. They're all there, so you can look back and see.
They're
lots
on
of
our
videos
page
we've
too.
done.
The links on our page as well. The links on our page as well.
So you've got access to all of these. They're recorded, all the sessions we've done, which have, they're very repetitive. We say the same thing because there's not that many different things you can talk about in breastfeeding, but actually they're all important, and you'll catch probably everything that you want to know about in those sessions as well. Probably in more depth, talking a little bit more and talking about it in different ways each time we talk about it. So, and then come back to us with questions when you watch the sessions, which is even better.
Yeah. Right, well, thank you very much all for your questions. We're going to sign off now. Next week it's going to be just me. Naomi's not going to be around for a couple of weeks, so and then we'll be reunited again in a while. So you have to put up with just me. So lots of questions, please, because I always find it really difficult when I'm on my own. It's much easier when there are two of us to bounce off. And so think between now and next week of all the questions you could be asking to keep me chatting for the hour. And thank you very much for the ones we've had this week.
Thank you for listening to us. Yeah, it's just lovely. Well done.
Okay.
And in this lovely
Happy Mother's Day to you all.
Yes, hopefully it's going to be nice and sunny.
Who's just snuck in? Hang on.
We've got another question.
Oh, no, I've got Elise and Taya all coming in saying thank you. Thank you.
You're very welcome. Have a good week. Bye.